it is time for us to step into the next session. The next session is a speaker session. Health as a key enabler of inclusion for persons with disabilities and lifelong health conditions. This is a session that is going to be moderated by our very own Rotarian Joyce Graff, who is the president of Powerful Patient Incorporated, a Brookline-based patient advocacy organization. After a 25 career in high tech, where she helped pioneer business email, she retired in 2002 to lead the VHL Alliance, the non-profit she founded in 1993. She has served on the boards of the National Braille Association, the National Organization for Rare Disorders, the International Kidney Cancer Coalition, and was executive director of the New England Regional Genetics Group. For 13 years, she was the consumer advocate for the kidney cancer program at the Dana-Farber Harvard Cancer Center. A multiple Paul Harris Fellow, Rotarian Joyce, Rotarian Joyce, the past district governor of District 7, 9, 10, and is a past president of the Rotary Club of Brookline and has served District 7, 9, 10 as Polio Plus chair and trustee. She is active in several Rotary fellowships, including travel and hosting and Rotarian quilters. She is indeed a lady who inspires many in the world of Rotary and in the world of inclusive education. Welcome, Rotarian Joyce Graff. Thank you so much.
Thank you very much, Sonia, for your kind introduction. I really appreciate that. Yes, I have been a mother of a child with a rare disease and have worked to find some help for people with this rare disease. We are honored to have with us today a speaker who has gone much the same journey. She is a researcher in the field of fetal alcohol syndrome and has made very significant contributions in that regard. She's currently the General Secretary of the International Federation for Spina Bifida and Hydrocephalus. And she's not only worked with what to do if a child is affected by these conditions, but also looked to find the source of the condition in the first place. Is there a way that we can reduce the number of children who are affected with these terrible conditions? And she has worked with the World Health Organization to identify things that pregnant mothers can do to ensure that their child is born with a normally formed spine and brain and has a happier life throughout their lifetimes. So I'd like to welcome Dr. Sylvia Roozen. She is with the University of Maastricht in the Netherlands, and she's going to speak with us today about this wonderful topic. Thank you so much. Welcome,
Thank
Dr.
you so
Roozen.
much. Yeah, thank you so much, PDG Joyce, and also welcome to all. Thank you for the invitation of having me, and compliments for all the team behind it, and in particular your presidents Ken and Dr. Adejojigbe. So warm regards also from our club back in the Netherlands, Club Elsloo-Maaskant. And glad to see so many Rotarians here present today. So today in this presentation, I would like to share why I believe that health is much more than just simply healthcare, that health is a key enabler of inclusion, participation, and dignity, And I gave a focus on spina bifida and hydrocephalus as an example, but the message is much broader. The message is about building health systems that leave no one behind throughout the life course. Maybe a first question that comes to mind, if you look at these two pictures, what do you actually see? On the left side, for those that are very familiar in this football play, you know that it is in fact Lionel Messi playing football. But on the right side, we see people playing the power chair football from the World Cup actually last year. And the only difference is how they play. But too often, when we think about disability, is what people notice first. But before disability comes the person, the athlete, or the student, or the employee, or the friend, or perhaps the neighbor. So inclusion begins when we stop asking what's different. So it starts by how can everybody participate, and how can we enable that? So therefore, as a starting point, health plays an important role in making that participation possible. Thank you, Joyce, already for the introduction. I'm carrying two hats today. So as an international federation, I represent a global community, and specifically for the condition spina bifida and hydrocephalus. We do that through the memberships, currently over 110 associations, but it represents around 88 countries. And all together, with the Brussels office, but with country representation, we work on the human rights, the inclusion, quality of life, where we advocate, strengthen also local organizations, and really promote access to lifelong quality of care. And everything we do is guided by one principle: nothing about us without us. And that's why the people from our community are at the core, at the heart of our work, and are the true leaders. What does health equity actually mean? So this two-day wonderful conference has shed light on different aspects, but if you think about it, what is equity? For us in our work, it's the absolute most important angle we can take towards inclusion and participation, because we need that everybody, of course, gets the care and the support that everybody needs to live healthy, but also independently, and of course a meaningful life. So when health systems are fair and inclusive, then they do much more than just to improve health. It opens the doors to sports, it opens the doors to employment, it opens the doors to student life, etc. So that is why it's so important. We asked that same question also recently through our members, because this year marks the 20th anniversary year of the UN CRPD, our global convention that we use. And the main question that we asked our members is, after 20 years of having a global policy in place to protect the rights of persons with disabilities, what do you still see as main barriers? And of course, the context is different depending where you live. But the commonality you can see here in the dark blue area, that highlights, in fact, the main barriers that we identified. And the biggest issue is access to healthcare and the availability of appropriate care. And that means that in many places, care maybe exists in certain forms, but it's not always the right kind of care. And for people with complex conditions, as you can imagine, the multidisciplinary care is very essential. And that also means that different specialists need to work together in a very coordinated way. So without this, care becomes a very fragmented, but the needs of the community are then not fully met. Here on the first glance, you see a very happy boy. So if you look at his face, you see a very pleasant young boy, happy, content in life perhaps, but he's holding something. And I'm going to show you what he's holding. He's holding himself, an own picture from when he was a newborn. And that shows, it's perhaps a simple, but perhaps also a powerful message, at least for me, because it shows that the disability is part of his life, and it does not define his happiness or identity. What matters most is that children like Zachariah, which is his name, are actually seen, included, and of course supported. We heard already yesterday a little bit about key facts around disability. The scale is very large. We're talking about a large population, large amount of people that live with a disability. But secondly, the diversity is also there. So that means that it's not just one condition. It's not just one disability. It's a wide spectrum of different experiences and therefore also needs. And with complex conditions, that means that the disability also is part of a whole life course. It starts maybe at birth or also before the birth, but the aging. We want people to grow older in a healthier way. And that's why the health systems must be prepared to support the people on every stage of life. And we have now a formal network within the WHO that supports the collaboration of organizations like ours, that we all try to strengthen health systems depending on the type of disability that we represent in our work. Let us look a little bit on art and history. I don't know if there are art favorites here in the room, but this is Bruegel, the old Bruegel. And these paintings, they go way back in the 1500s. And these paintings, you already see something very clearly. On the left, you see the blind leading the blind. It's the formal title of that painting. And on the right, you see the cripplers or the beggars. And at that time, in the 1500s, disability was often seen as a fate or misfortune, in fact. And the people were frequently left on the margins of society, not at the center or the core. But today our understanding has, of course, shifted and changed, where now the disability as a matter of human rights and support systems is much more clearer. And that is a key shift from exclusion to inclusion. And here you see that shift by Frida Kahlo, who was also an artist, as you may know, but she also lived with a severe disability that we believe could have been spina bifida, but also chronic pain. And I show you this because it's about lived experience as a form of an identity, to see that the medical condition is simply also the experience and beyond of the expression that you want to give as a human being, and also to shape in that sense your identity. Now, Frida, she shows that people with disabilities are not defined by their limitations. So it's a very nice example on how to make that shift from the Bruegel to here. I'm not going through the whole line of history because that we already heard in yesterday's talks a little bit, but just to refresh the memory, because everything we're saying today comes back from the past. In fact, in the antiquity time, we were talking about disability also in terms of myth and religion or superstition, but also the word monster came. The word monster from the Latin monstrum, which means a sign or a warning. And that's related to a verb, monstrare. And that means to point or to show. And that's not so negative, but in the old days, if you had a rare condition or a disability and you could see it from the surface, then the monstrare also showed that people put the person in front of their houses, in front of society, to also ask, what can we do about this child? What can we do? Is there another person with a condition that we can maybe find an answer to? So through the ages, you see, and we already heard that we came from that perspective of myth, religion, seeing things as medically or seeing things as the handicapped and the disabled, but we grew out of that age period. It's now really about recognition of the disability rights, and disability also meaning persons with abilities. If one then combines it to the evolution of the attitudes. So where we came from was abandoning, exclusion. Think about the Bruegel paintings. It was really about putting the people out there. And we also went from a time of punishment and institutionalization. And unfortunately, I heard it just before, indeed, it still takes place. But we are now in a century where we can really make strides. And we are doing that also through putting the people at the core of the society in the discussions to enable also participation in the policy dialogue. So that means that we have come far, and our highest standard of that policy change is the United Nations Convention on the Right of Persons with Disabilities. And I'm very pleased that now today over 180 state parties are actually supporting that. So enough about this introduction, about the history. I want you to meet somebody very special, and that is Kishon. I hope that everything works in the audio. If not, then let me know.
Kishon Dakis is just like any other piano-playing prodigy who struggles with mastering the notes. But coordinating with the keys is not the only worry Kishon has to create that perfect piece.
So Kishon was born with spina bifida. It's a birth defect where your backbone did not completely close. So anything below that is affected, in his case, including his mobility.
Kishon has been using his wheelchair for most of his life. This in itself has wheeled him some challenges, especially during his recent transition from elementary to middle school.
The biggest difference is that the campus is kind of bigger than my other campus, and we don't stay in one classroom. We switch every hour for different classes. But when I have to go down to the field because there's like portables, it takes me a long time, and sometimes I'm late to class.
His teachers are understanding, but there are areas where he feels left out.
But when I see like other kids playing football or soccer, sometimes I feel like, oh, I wonder how it feels like to play football or soccer.
Despite him being in a wheelchair, Kishon pushed himself to do what he and his family thought were impossible.
Sports. I never thought he would be able to play any kind of sports.
Through the years, Kishon has been on a roll. He is involved in numerous sports, including tennis, surfing, wheelchair racing, and swimming.
I like to do these things because it's fun and it gets me exercise. What I like about swimming is I get to meet new kids, and I get to get along with them, and I get to meet my new coach, and I get to go to other places like Oahu.
You are amazing.
Last year, Kishon brought home a silver and a bronze medal from Special
I
Olympics.
got them in Oahu for Special Olympics.
After keeping himself busy with school and sports,
Which I got scared because I thought there were sharks.
at the end of the day, Kishon will ultimately go back to his first love.
My hobbies are playing the ukulele and piano, and a little bit of guitar. My favorite is playing the ukulele. I started playing the ukulele 4 years ago when I was 7.
He goes to parties and community events, and he plays and sings for the community. Kishon is unique because he proves me wrong. He not only lives up to my expectations, but he soars above it.
Even with his disability, the support Kishon has from his family, paired up with his cheerful attitude, has enabled him to pursue his numerous involvements, proving that he definitely is able.
Yeah, very nice video to also move away from the theory and from the theory back to also reality. Yeah. Okay, so That means health equity. So it's also important that we think also a little bit about what can we do to prevent the cause of harm where possible and to support that full inclusion. So that brings me to the different types of pathways that can lead to a disability. Some are present already at birth, some occur during life, but others happen even before or around birth, linked to environmental factors or prenatal risk factors. So these examples that you see here, they show that the disability has multiple causes and also life pathways. But the main message, if we talk about congenital malformations or acquired forms or prenatal risk factors, the main message is that the different pathways that causes the disability can be different, but it all requires the same health, social support and inclusion from a societal perspective. In Nature briefing, it has already been some years, but there was a very nice quote that I came across. And that quote was, if you wait until after birth or long time after birth, then you may miss an opportunity, a window of opportunity to prevent irreversible pathology. And that reminds us that the timing to health also matters. I have a video to show you how that timing in the first 2 weeks in the pregnancy matters for us to understand the complexity of birth defects. I'm going to play it now.
This is how a human gets made. Every one of us started out this way. We've a pretty good idea what happens over the 9 months it takes to produce a newborn. But there's this one bit that's been missing. Right at the beginning, before this animation even starts. The very first few weeks. Now armed with new ways of growing human embryos in the lab, scientists are learning what the very beginning of human development looks like. For decades, studying this crucial early time in a human embryo's development was a technical headache. Embryos are hard to get and keep alive outside the body. And it's an ethical challenge. Guidelines put together in the late 70s and 80s prevent scientists from growing embryos for longer than 14 days. Despite the hurdles, scientists do know a bit about what happens in those critical weeks, often from animal studies or rare human tissue samples. They know that sperm fertilizes egg, and one cell grows to 2, 4, 8, and so on. Around day 5 or 6, the blob starts to feature different types of cell. Scientists call this blob a blastocyst. All being well, the cells in the blastocyst begin to differentiate. 1 week in, it implants into the wall of the uterus. What happens next has been a bit of a mystery. By implanting itself into the womb's wall, the embryo basically hides, and that makes studying it in humans impossible. One way of exploring this crucial time is to study embryos donated by people who no longer need them for fertility treatment. In the last few years, several labs have developed new ways to nurture these embryos. Their techniques have allowed them to start building a picture of human development that's more detailed than ever before. Here's a day 6 embryo growing in a lab. Cells destined to become the actual fetus are tagged in green. Those that go on to form the placenta in blue. By day 8, the cells are sorting and arranging themselves. The green fetal cells have condensed together, and in red here are cells that will form the interface between the baby and the placenta. It seems these extra embryonic structures develop a little later in humans than expected from studies in other animals. Day 10. The whole thing increases in size, and bundles of cells start developing into support structures. Surprisingly, at this stage, the embryo can direct its own development with no input from the mother's tissues. By day 12, the outskirts of the embryo are preparing to bind more strongly to the wall of the uterus. After all, if this were a natural pregnancy, the embryo would be there for the next 9 months. You can even see little holes appearing ready for the mother's blood vessels to start supplying the embryo with essential oxygen and nutrients. By now, the embryo is signalling its presence to the mother via a hormone, the one that pregnancy tests pick up, HCG, labelled here in yellow. After 2 weeks, the teams ended their experiments in line with the ethical 14-day limit. To study what happens after 14 days, researchers had to turn to different techniques. Recently, scientists have built artificial embryo-like structures from stem cells. Using these partial models, they can study things like cell signalling, or even the formation of the primitive streak, the crucial thread of cells which guides a process called gastrulation. That's the moment the embryo decides which end will become the head. Here they use human stem cells growing in an animal embryo to explore that process. But even after this early phase is over, there is still a lot of work involved in building a body. To study later phases, scientists have made and analysed high-resolution 3D atlases of human embryos and fetuses. One team found that the left and right hands don't simply mirror each other when growing their nerves. Instead, some branches take random paths in each limb. Another group saw muscles that grew in early embryos only to disappear as the fetus developed, like these. As yet, they're not sure why. It's becoming ever clearer just how important a human embryo's first few weeks are. Many scientists hope that more research will lead to a better grasp of why some pregnancies fail and how birth defects arise. Maybe even make in vitro fertilization work better. But some just want to understand exactly what happens to this tiny ball of cells in this short spark of time at the beginning of all of us.
You see here three pictures. So historically, we have a very much of a love affair with alcohol. And nowadays, it's very normalized in societies and also often seen as a part of our culture and the lifestyle. But we also know at the same time that alcohol can have serious risks, especially during the pregnancy. Now, this is not something new, because in the time, and you see here the Queen Mary and King William of Orange, when they were set throne in England. And why is that of interest? Because England at that time, they were in war with France. And in that context, alcohol plays an interesting part, because when you are in war, you don't import anymore the products from that other country. So that means that England boycotted, in fact, the brandy, and they introduced the gin. And now the field lesson here is that the gin became very accessible, available, and it led to a gin epidemic. And you can imagine the harm that was increased significantly across the society. And that means that that is our lesson from history, that when you make something very widely accessible without any barriers or safeguarding principles, then the harm can also grow very quickly. So today we see very similar patterns on the alcohol that we buy, etc., the way we put a commercial to it, but from a public health perspective and prevention policies, very important to keep in mind. Now, one of the serious health outcomes, and that's where Joyce, where you introduced me, is the fetal alcohol syndrome, or from a whole spectrum perspective, the fetal alcohol spectrum disorders. Now, if you look at the faces here, these are children born with this condition. The prevalence of this condition, the group of the condition, is 22 per 1,000 live births, which is extremely high and still not yet widely recognized or well understood. On the left, it's an article where the title says alcohol damaged Casper, and the mother says, well, even counting to 5 does not even work for him. And on the right side, you see a different framing, which is more blaming and simplified, that suggests that the mother simply loved the drink. Now, this contrast is very important because it shows how the narratives can either support the understanding or reinforce stigma, in fact. And maybe interesting to keep in mind when it comes to these conditions, alcohol is the main course and therefore also 100% preventable, and we need to keep in mind the non-judgmental support also of families. We all know that it has severe risks. It's well understood, also stated by the IOM already earlier, 1996, but it underlines how alcohol exposure can, early on in the brain, defect the development. And I want to guide you briefly because it's a behavior. The drinking is a behavior. I want to go through with it briefly. If you think about a problem or a challenge like this, then you think, well, it's easy, no? It's very simple. I mean, if you drink, you can also stop drinking. But the challenge is not so much the drinking. The challenge is, how do you do that? If you do something on the one hand and you want to stop doing that. I share with you here two images to give a bit of the complexity, because not everybody is at risk. It's not the case that if you drink alcohol, that you can also, when you drink it during pregnancy, that you can also have a child with a syndrome called fetal alcohol spectrum disorders. That's not the case. It's much more complex than that. And that you see on the right side. You see metabolism factors involved, predispositions, the epigenetic influences, but all of these factors, all of these green, red dots that you see, all of that could be affecting how a child can be born. And that complexity is quite important for us from a scientific point of view, but of course to give a message, because publicly, how do you then convey the message to the public? Well, not drinking is the safest, but that of course does not explain everything. Just something that you may recognize in daily life. We are now half in this new year. And at the start of the year, I'm a victim of that. I always make New Year's resolutions, and maybe you do that too. At the start of the new year, we all say, this year we're going to do something much better. We're going to exercise, we're going to eat healthy, we are doing less social media. That's very popular these days. But when you are going further in the year, how much of those objectives have you actually reached? And that means that if you want to change behavior, the real life is much more complex, because you have habits, you have the environment, you have the motivation that plays part of that, stress, social context, maybe the influence of your partner. But this already reflects why it can be so complex. Two examples to show you that the world really has changed a lot. It's not so long time ago that one could smoke in a hospital. Now we could not even dream of it, not even think of it. It's not done. On the right, you see an example of the belt. The seat belt was, a lot of cars in the old days did not have a belt. But due to the public health messages, we came to understand that there are risks and that we need to prevent risks. Now, the same goes for disability. Now, this is not to show you that it's now time for a break. It's not time for a coffee, but I want to trigger your thought for something else. If I would tell you that the coffee stall that is part of the coffee, that could be very harmful for you, and the coffee stall needs to be filtered in order to be healthy for you. So think about the machine that you are using to set and drink your coffees. Maybe it's filtered, maybe it's the cups unfiltered, doesn't matter. But if I would tell you that if you use filtered coffee, it's okay, and if you used unfiltered coffee, it's not so healthy because of that coffee stall. Now, with that knowledge, would you change your behavior? I guess not. So that is just by the awareness, by somebody telling you what to do instead, that is not enough. There are things that play a role much more than that. We also asked pregnant women that question, because if you think about alcohol, the question is simple, just stop drinking alcohol. But that's not so easy, because what they thought, what came across in that question is that some women said, well, I am not at risk because my mom drank also when she was pregnant, so I'm sure it will be fine. Or maybe others may struggle and say, well, it's part of my stress levels and it helps me to reduce stress. You see here different arguments, and that means that it's not just a concept of knowledge, that you don't know that it could be harmful. There are multiple groups of beliefs and reasons that we call social determinants of health. Think about the risk perception, for instance, and the uncertainty that you may or may not do something harmful. Well, you rely also on information as an example, outcome of a method. So I don't want to confuse you more than this, but it's just to show you that the process of understanding where things are coming from and to identify those key determinants is very important, because it helps us to understand why people behave the way they do. And luckily for us, there are also protocols available, that there's not one single approach out there that we can apply. And this you will recognize, because same goes for the household. Not every method is effective for every problem, because if you have a challenge at home and the challenge is the loose screw, then your solution is not the hammer. Your solution is the screwer. So that means that also in real life, we all recognize that. Now back to the other example, and that is the neurotube defects. The neurotube defects, it includes different conditions. Spina bifida is the most frequent one, and it means that the development, it created an open back, an open spine, can also lead to hydrocephalus. But the other forms, and you see it a little bit in the graphic on the side, the other forms such as the anencephaly, the iniencephaly, they're not really compatible with long-term survival. Also with encephalocele, that can lead to severe disability or even early death. So that means that these outcomes, the seriousness of neurotube defects across the spectrum, is important that we pay attention to that. In terms of prevalence, also here, the prevalence is quite high, because we see the neurotube defect present in 1 in every 500 births globally. But what is now interesting for neurotube defects is that we see a message for prevention. And why? Because countries that implement food fortification with folic acid, that is a B9 vitamin, we see that those prevalences of neurotube defects are much lower. So that also shows that a population level prevention can make a real and measurable influence. So we move from what not to do towards what we can or should do, while having a look at risks and determinants and solutions. Well, I like always history. I always like to go back to where we came from. Well, not even 30 years ago, we knew actually that neurotube defects could be prevented at all. So that's why research is so important to inform us in that sense. And the major shift was really from medical to public health knowledge. And that really made us think about, what should we do? And you see here that the advice even is 400 micrograms of folic acid to take daily from 8 weeks before conception. And that creates some challenges to the public. If I show you these graphs, then try to focus on the 2 colors. What you see is that the green color shows a smaller bar than the gray color. That means that in the greens, that those are the countries that have food fortification in place. And the greens show that there are lower prevalences of neurotube defects in those countries. Very clear example. And on the right side, it's the situation in Oman, and very clear, the line goes lower, and that also means that as soon as they put a policy in place on food fortification, there was indeed a reduction of neurotube defects. Well, we are guiding ourselves also through policy, but also explore what can we do, because if these countries are already doing it, can't we then also support further implementation of that? And that's something that we have looked into with different partners. The difference between folic acid and food folate, well, maybe just for you to remember that on the one hand, the natural folate is present in the food, in the greens, in the vegetables, in the fruits. And on the right side, you see the synthetic form of folic acid. And then you will most probably have the question, but can't we just then eat enough greens? Isn't that just sufficient? Well, the answer is actually no. And that is in particular the challenge, because if you want to reach that 400 micrograms of folic acid, well, it's practically impossible, because you need to eat 44 ripe tomatoes. You would need to eat 45 cups of cooked broccoli, or 23 spears of asparagus, or even 2 slices of fried beef liver every day. So that is not possible. So that's why we look into policies that are actually working. And food fortification is one of those effective policies where you actually just simply add vitamins and minerals to food during the production process. And you can do that with wheat, you can do that with rice, you can do it with other commonly consumed products. And in fact, it's a simple, safe and cost-effective way to improve the public health at the population level, as you can imagine. And currently there are 94 countries with legislation, which is very good, but we also thought about accelerating that a little bit, because we have more than just 94 countries present in the world. And that's why we advocated with the partners that you can see on the logos on the left poster. We advocated for a World Health resolution specifically to address this public health challenge. And that was adopted, in fact, 2 years ago. If you think about costs, no, it's not a cost. It's not very costly. You can see it here, $5 when we think about the wheat flour, $6 when we think about the maize flour. But it shows that it is a high return on a minimal investment. And that's something that we all like, being economist or not. If you're interested, then have a look here on these resources. But what both have now in common, Spina Bifida, as well as with the fetal alcohol spectrum disorders, is that they relate to preventable forms of disability. And that is not just about assigning the blame to people who is responsible. In fact, from the historical perspective earlier, we need to understand disability from a shared responsibility of society. And then it's not so much about the individual, no, it's much about all these levels from a socio-ecological perspective. And also in the end, that if we think about prevention, you also need to think about those that are already living with the condition, and you can make the societies much more inclusive. Now, actions need to take place on different levels, and I show you this picture from our recent conference, that we also see between the regions in the world, between the countries, that different priorities, different actions need to take place, but also the levels of activities are interconnected. Now, enough about that. It really is about the lived experiences and leaving nobody behind. That is what matters the most, and it's a commitment for all of us to the real people in the real situation. And here you see the real people in the real situation. In the case of Spina Bifida and Hydrocephalus, we talk about the forgotten half. And that refers to lifelong needs that are not always fully addressed by the health system. Disability inclusive health, we also heard that earlier, but it really must include early diagnosis, rehabilitation, assistive technology, assisted products, continence care, mental health, transitioning to adulthood. All of those are not optional services. They are essential for the quality of life and for the inclusion to society on other domains. So saving lives, that's not enough. Many health systems are designed to save lives, but not always to support lives, in fact, over a decade. So for true inclusion, we really must ensure that lifelong care is built on continuity and dignity. And to bring this to life, well, I had for you prepared a video by our Kevin from Scotland. Is an older person with Spina Bifida, but I'm afraid with the glitch that is still on my screen present, I cannot show you that. But I'm more than happy to share with you afterwards, because his story is really powerful. He reflects on his own journey when he was younger, and he reflects on how he looks at it right now and nowadays. Now, I'm almost coming to the end, and if you think about health systems, who do you think are now the most important carers? Often, and that is also coming from my own background, often we think, oh, that must be the neurosurgeons. There must be the nurses. It must be the specialists in one way or another. But the reality is that the most important carers are often elsewhere in the system. And the first point of contact for the person with a disability are the parents. And the last person of contact for the person with a disability are also the parents and the siblings. So these are the ones providing the daily care, the support, the decision making, especially in complex conditions. So if we want truly effective health systems, we must recognize that support for the families as a central partner in that whole care pathway and model. They're not just observers. They are the real key actors in the systems that we should not forget. Now, I showed you some art. Now music. So I don't know if you recognize, but these are the 3 tenors. And what we can do with the 3 tenors here is the metaphor to healthcare, because each tenor has a strong individual voice, as you can imagine, going to one of the concerts. But the real power is not so much in the individual voice. It's when you sing together and are fully supported by an orchestra. So in the same way, we can look at health that is not just delivered by one professional alone. In Spina Bifida and Hydrocephalus, we for sure require coordinated care between many disciplines. But when this collaboration works really well, the result is also much better care, better outcomes, and better quality of life. Well, health, I started this presentation by saying health is a true enabler of inclusion. I stand by that, but access to health is not equal for everybody. And this picture comes from my personal collection working in one of the areas in this world, but it reminds us that the communities are still underdeserved. So we can talk about health being an enabler for inclusion. We need to keep in mind also where there is underserved support of health. And this very nice image, the title is in Spanish, but it shows you that the woman that you see here, they are blind women, they are Muslim women, and they're performing together in an orchestra. And a very nice example, I think, of inclusion in practice. It challenges us to think about the common assumption about disability, religion, and ability by showing participation in a highly coordinated and public cultural activity. So very nice. Well, Rotary, that could not have been left out, being a Rotarian myself. I want to highlight that there is always an important opportunity for collaboration, as you are also showing here with the World Rotary Club, in fact, on disability and advocacy. It's very important because when you combine the actions together, you can really move the world in a very positive way. And here you see some of our members of the network. At this moment, we have more than 50 Rotary clubs worldwide in one way or another working with us in the work on spina bifida, prevention, care, and inclusion. And it's very positive to see that also going on. I heard already before, the Polio Day is October 24. For us, the World Spina Bifida and Hydrocephalus Day is the day after, the October 25th. But the main message is not so much the day. The main message is that there are important global momentums to connect the agenda on disability rights. And on that note, I thank you very much for inviting me, for having me here, for your attention, and for the organizers, and maybe also think about after this presentation what you can do to enable inclusion for everybody. And I look forward to the continued conversations after this presentation. Thank you.
Thank you so much, Dr. Roozen. And we have a couple of questions that I want to go through in our Q&A pile. but you've really shown us the power of having a community of people working together to find solutions to very thorny problems, very complex problems. Spina bifida and hydrocephalus certainly are one of the more serious complex conditions that a child can be born with, and to have an opportunity to hopefully reduce the number of children who have this challenge is amazing. So the country's working to do that for their populations, and groups of parents and concerned citizens working together, I think, is going to make a very big difference. Certainly to include people in society. It's not their fault that they were born with this condition. We do the best we can to support them through the critical stages in infancy, the corrective surgeries that may be required and things like that. But then we shouldn't forget them, because they're hopefully going to live a long and productive life. But if we include them and if we exclude them, then we're missing out something very valuable from the society. So thank you very much for a wonderful presentation. How do we envision the elimination of polio? Well, this is a polio question, but we could talk about it with any serious condition. And so for the conditions that you're talking about, how do we envision eliminating these conditions or reducing them in places like Pakistan and Afghanistan, where they have so many other challenges? What do you see from the World Health Organization for those?
Yeah, well, it depends a little bit on the question at hand, right? So for us working in those countries, similar countries like Pakistan, is about building consortiums and coalitions. So that means that from our side, we look at it, we have a representative organization there of, in this case, Spina Bifida and Hydrocephalus, and they connect with others. Think about the coalition that you can include national disability organizations. Pakistan also has one. Healthcare professionals, key champions on the healthcare professionals. And what you then do all together is that you form an agenda. So if you say, well, we want to stop the irreversible pathology, that means prevention, then your question is addressed to the Ministry of Health. So one needs to find steps together to advocate towards the Ministry of Health. And there's also another way, because that is the bottom-up approach. And we also have a top-down approach. And that is that there are partners in this world, us including the international umbrella organizations, that can lobby and advocate on your behalf. So I would argue very much for coalitions and forming strong networks together and seeking other voices that can support your mission in that.
Thank you. The other thing that comes to mind is you mentioned that the best way to prevent spina bifida is to make sure that the mother has folic acid 8 weeks before she becomes pregnant. So if you think about teenage pregnancies, they're unexpected, they're unplanned. How do you make sure that a 17-year-old girl is getting enough folic acid 8 weeks before she might perhaps get pregnant?
Yeah, very good question. And that is now exactly the challenge, right? So you not always know also that you're pregnant, so let alone the children in the childbearing age. So the good thing about food fortification over supplementation is that food fortification is already embedded in the foods. So if you buy a bread or if you buy rice, that means that in a lot of countries, luckily, it's already there in the product. So that means that you have already a kind of a good base in that regard. So that's why we advocate, in fact, for food fortification, because with supplementation, you need to get the vitamin. And that means that often you are being prescribed once you recognize that you're pregnant, and that is indeed too late. Yeah.
Right. I heard that in the United States, breakfast cereals have folic acid in them for that reason. Is that right?
Yeah, that's right.
Are there other good examples? You mentioned flour and rice.
Yeah, flour, rice, Corn maze, corn maze is also a good example. Nowadays, we're also working with the salt to fortify the salt with folic acid. Ionized salt is already there, but not yet with the folic acid component. And there are good studies now showing that that is very effective. And there are also some low scale, smaller scale opportunities like tea fortification. And well, you can think about a lot of things, but it's always good to think about what are the people eating the most. And that is where your emphasis needs to be on. Yeah.
Right. Very brilliant. Thank you. Thank you so much. Are there any other questions from the audience? I'm looking at the Q&A if you want to pose a question. One of the questions in our Q&A right now is, you mentioned that the parents are the most essential support people, the first and the last, but how are these individuals taken care of throughout their lifetimes? How can they take care of themselves?
Yeah, that's a very good question. Yeah. Well, the reality is that the system itself is not equipped for that. So the focus is not so much on the parents, but that's why the support groups are very important. So the national organizations for specific conditions, like in our case, Spina Bifida, the support groups are very important because the parents can learn from each other. They can lean on each other. The associations often also come up with a lot of nice programs and projects to support the parents. So I would definitely say for the person that asked the question, explore those networks because they can be very helpful in that way. Yeah.
Right. And of course, these kinds of nutritional supplementation issues are one of the things that cause these conditions. Genetics sometimes is at play, and cerebral palsy is another one that comes to mind. There's a community in Kenya where there's a high prevalence of cerebral palsy, and I said, why is that? And it turns out that they're far from a hospital, and it's very hard to get a woman who's giving birth to the hospital in time. So too many births are happening at home without the proper support, and oxygen deprivation during the birth process is a contributing factor to cerebral palsy. So
yeah, exactly. Yeah, it's very important, and those barriers are not so easily to address often in those rural areas. But the portion of disability and untreated forms of disability is very high. Yeah, so that's absolutely a key example on how to reach the people in underserved communities. So yeah, health is not equal for all. That is the main conclusion for sure. Yeah.
Right, and that's true in all the countries of the world, including my own. So
yeah,
that's
exactly.
Right. Well, thank you very much, and we appreciate your contribution to the conference and your excellent presentation. Please keep up the good work. Thank you.
Thank you, and I really enjoyed the meeting so far. Thank you so much.
Thank you. And back to Sonia.
Thank you, PDG. Joyce, thank you so much. Thank you. That was a wonderful presentation. It really helped, for me personally, it helped me reflect on a couple of things. At one point, I felt I've gone back into my school with a biology class, and then suddenly I've gone into nutrition, and then I've now jumped into other aspects of support and consumer advocacy, and that was so well put. Thank you so much. A few reflections that I think it's important for us to keep in mind is that when it comes to women's health, we don't talk enough about it. And this is why this health summit is so unique, that we have ensured that we have catered for almost every group of individuals that would get affected in one way or the other by disability, and not just those who are already living with disability. So it is important for us to take this knowledge, share it with others, explain to them why it is important to have folic acid, for example. We come from cultures where we hear, the elderly explaining, we never took these things, we didn't need to take these things, you people, you just dump chemicals down into your body, and, that is why you have all these complications. But understanding what they do to your body is very, very important. And I think being the chair of the inclusive education pillar, I definitely would like to request Dr. Martha and the team, let's team up and let's see how we able to educate young girls about this, including coming up with ways of working with schools and sharing this knowledge with them, because we would love Dr. Sylvia to come back and give us more information, especially to the young girls.